Hi, I'm Gilly Bond. I'm a clinical specialist pelvic health physio, and I'm going to talk to you today about how to get rid of that pelvic pain and to manage it a bit more effectively. Quite often when you've had pain in the pelvis for a long time, the muscles go into a little bit of spasm. And you'll see a physio, or hopefully you should see a specialist pelvic health physio. If you haven't yet, then get yourself to one. And they will spend some time relaxing and releasing those pelvic floor muscles, and it'll feel great. And your pain will get better and your symptoms will improve. That's something that we often see in problems like interstitial cystitis, which we now call bladder pain syndrome, or complex chronic prostatitis in men. Lots of different syndromes. Actually, if we can get those pelvic floor muscles to relax instead of being all like this, then everything starts to improve. The problem is that you go and see your physio, you have the release done, you feel great, you leave, symptoms are improving. 3 days later, everything starts to come back again. What we need is to be able to release those muscles and keep them released for a longer period of time. And we know that if you do that for about 6 weeks, continuously, releasing those muscles regularly, then everything really starts to feel better and stay better. Now, it's often difficult to get in to see a physio, and this is something I feel very passionate about, that you shouldn't have to see a physio all the time. You are the maker of your own destiny and in charge of your own health and your own body. So if you have the ability to release and relax those muscles yourself, then everything's going to get better a lot quicker. Now, the way that we do that is by using a therapeutic wand. If the pelvic floor being released by the physiotherapist, using their hands generally, manually, works really well for you and you feel comfortable with the idea, then using a therapeutic wand can be a really good way of you effectively managing your problem for a long period of time. Yeah, hopefully you won't have to use it forever, but it's something that can be really life-changing. So it's firstly really important that you have seen a specialist physio. We need to make sure that it's the muscles that are causing the soreness and that with a muscle release you get relief from your pain. So always, if you're going to listen to the rest of this video, then make sure that you have seen a specialist before you proceed with using a TheraWand or any kind of therapeutic wand, and that they agree that that's something that you should be doing, okay? Because there's lots of different reasons why it hurts downstairs, and this is just one of them. So there's two main types of therapeutic wand that we have in the UK. There might be more elsewhere. This is a Easy Magic Icy Relief. Really lovely glass, soft, round end here that can be used for release, as can the small end here. It's got a lovely soft curve, it can be heated, it can be cooled, and it's a very nice wand. And then this is the premium TheraWand, which is just one of the ones. There's also an essential, which is a bit wider. It has knobbly bits, which I like to call the handle, and then the treatment end. Now this is the wand that I use, this is the wand that I have used in my research, and I think it's just a preference thing, but this is a wand I use very often, and it's because it has exactly the same diameter as my finger and length. So that's very reassuring for my patients, so they know that if they've had the treatment from me, that the TheraWand shouldn't feel too much different. Okay, so with the wands, you're only ever going to use the first section up until the first curve on the TheraWand. And you can see it's about the same length as my finger. So to start off with, it's important to think about the anatomy of your pelvic floor. Okay, we're going to talk about vaginal treatment. It's different for men, and that's something that you need to discuss with your specialist physio. Obviously the principles are the same, but the access is different. So if we think about the pelvic floor to start with, we've got a lovely model of the pelvic floor here, a female one. We've got the back passage, and then the vagina is quite far forward. We're going to access the pelvic floor through the vagina. The tube to the bladder is at the front here, and you can see that bowl-shaped group of muscles, so it's sitting down in the bowl, and they all attach into the back here, into the coccyx, the lowest bone, and all the muscle fibres come out to the side and forwards, okay? Now, it's important to think about the structures that are there. So you've got your back passage and your bladder at the front, and both of those things we don't really want to poke with a TheraWand. So if you think about a clock face, and we've got 12 o'clock at the top here and 6 o'clock at the bottom, which is probably looking the opposite way around. No, that should be the right round for you. At the top here at 12 o'clock, we've got the clitoris and the pubic bone, and the urethra comes up here. That's the tube to your bladder. At 6 o'clock, we've got the back passage. So again, we've got a structure coming upwards. So if you think about the TheraWand coming up in the centre through the middle of this clock, we're not going to go sweeping, using the wand, turning it and twisting it, between about 11 and 1 o'clock, nor between about 5 and 7 o'clock, because those structures are delicate. And to be honest, you should feel it if that happens, and it will be uncomfortable, but definitely stay away from those zones. Anything down the side of the cock is fine, and what we want to think about is using the Therowand more towards the back. Now, this is something that I've used a lot with patients, and I just find it's a quick route. I am a big fan of doing the least amount possible and getting the biggest benefit. So we've got our Therowand. The next thing we need to think about is what position we're going to lie down in. So I would suggest that you have your back propped up on some pillows and your knees bent and relaxed. And in that position, you're just going to take some lovely deep breaths in to try and release down below. Next, I would get some lubricant onto the top of the Therowand. Anything that you want to use. I personally like to use the Yes oil-based lubricant, which is available online. It's lovely, it's organic, it tends to be the least irritative, and it's something that I use in clinic with my patients that have any kind of pain downstairs. So some lovely Yes lubricant on top here, just for the Therowand. We're going to place the Therowand onto the perineum and think about where the opening is, and you're going to slide it in, but at an angle. And I always start at 5 o'clock or 7 o'clock, so one of the sides. So when you place it in, the Therowand at the bottom, your handle, is going to line up with your leg, okay, on a bit of a diagonal. With the wand there inside, you see that I've stopped when I get to that first curve. Again, so that's about the same distance that I would be back. You don't have to put it in that far, you can keep it a little bit further back. And what you'll find is that when you pop it in, because the muscle is so raised, that actually you have to come up onto the muscle very often. So we've got the Therowand in, and we're aiming for about 5 or 7 o'clock. And we're going to rest it there, using the whole length of the underneath of it. We're going to think about pulling in our back passage, as if to stop from breaking wind, and that will lift the muscle, and you should feel it underneath. If the muscle lifts, you'll feel that the handle comes down, and then you're going to use the handle with a gentle amount of pressure, very gently, okay, gently. You're going to use it to guide the muscle down as you release. So when your physio has done this with you, they've been using gentle pressure to get you to activate and then relax all the way down with that muscle. We're doing the same. This isn't poking and prodding, this isn't being forceful. We're going to do a gentle release, okay? You can put as much force as you're comfortable to tolerate, but I wouldn't be too hard. But again, don't be worried about going a bit harder. This muscle is as strong as your hamstrings, if not stronger. So it can take a bit of force, but just be respectful of your pain at all times. It can be uncomfortable, but it shouldn't be painful. So if you're getting any pain or any bleeding or any other symptoms around the pelvis after you've done this, then maybe you should be talking to your pelvic floor physio, and certainly if there's any bleeding or any other concerning symptoms, get yourself straight to the GP, okay? But as I've said before, this should be something that reaffirms what you're already doing with your physio, or it's something that maybe now is going to give you the idea to go away and talk to your physio about teaching you how to do. It's always worth getting one of the professionals just to try it out with you once in clinic. Most people are very happy if you buy yourself a wand to go in there and say, can you teach me how to do this? I just want to make sure that I can keep repeating the response that I'm getting with you in clinic at home. So we've got a couple of releases on one side, okay? Now if we want to do the other bit of the muscle, what we can't do is just turn it round, okay? Because remember, at 6 o'clock we've got a back passage, so if I try and turn that wand, it's just going to bash into my back passage, and we're really not going to like that, okay? So if you're going to the other side, you're going to have to pull out the wand a little bit, turn it round, and put it back in onto this side, okay? So now we're again, wherever you started, you're either at 5 or 7 o'clock, but you've moved around. Repeat the process on the other side, so you're going to think about pulling in that back passage and relaxing all the way down a couple of times, using the full length of the underside of the wand to help you come down. After that, this is really, really nice as a way of teaching you how to feel where that muscle is and be able to switch it off. So you're going to think about just sliding it back into where it was and then resting it on top, like a finger just kind of telling you where that muscle is. Think about pulling in your back passage and then relaxing all the way down. And you should feel that the underneath the handle tips down as you pull up, and it tips back up as you relax. And it's the relaxing that you're interested in feeling, because you have stretched the muscle gently to begin with, maybe 5 or 6 times, and you've taught it that actually it needs to be able to relax. And now you want to know that it's got the lesson, yeah, that it's got it. So you're going to see, can it now relax on its own? And if it doesn't move, put a little bit of pressure and see if you need to do that a few more times. Okay, so that's how I would do a session. I say to my patients, do 5 or 6 releases on each side at 5 and 7 o'clock, because that's where the muscles all start. So that's where we've got the biggest, thickest bunch of muscle fibre going on to begin with. And that tends to release the whole of the muscle all the way around. It tends to start releasing it anyway, making it feel a lot more comfortable. When you've done your 5 to 6 minutes releasing and relaxing and working out how to make sure that the muscle can then release on its own, pop the wand out, wash it with soap and water. You don't need to use any alcohol gel, that will scratch or stain the surface. We just need to keep it clean, okay? And the instructions on the manufacturer are very clear on that, so have a read. Pop that aside, and I would do a little bit and often, so 5 minutes every day if you can. It's when you've got out of the bath, it's before you have a shower, something like that. It can be done on the bed, it can be done in the bath. Those are both really comfortable positions. Lying down is easiest. I have some patients that prefer to stand up and do it in the shower, and that's fine as well, or stand up in the bedroom. It's just a bit more difficult because you're up against gravity, so your muscles are already clinging on slightly. Okay. If you have any pain lingering, as I've already said, it's important that you tell your GP or at least your physio first, so that they can get you some help and kind of work out what's gone on. It shouldn't be an excruciating process. It should be that actually you feel lots better afterwards. It's a simple, gentle release. There are some people that like to do sweeping around more of the clock face, so they like to come out to the sides on either side, and that's fine as well. There's some really lovely research showing that theal massage, which is this sweeping motion along the pelvic floor, can help relieve symptoms. But I would say that that's something that the specifics of what you do to your pelvic floor should be discussed with your physio, because they know your muscles. We all get knots in different places. We all have different tensions that are related to what we do, what postures we sit in. So the release that I've taught you is what I teach everyone to begin with, so that they can carry on doing what I've managed to achieve with them in the clinic setting at home, and continue to release and feel good. But specific areas other than 5 and 7 o'clock, I would talk to your physio about, because there are lots of other areas that are useful. Okay, so I hope that's been useful, that if you haven't been using a TheraWand, that you now might bring up that conversation with your specialist and say, is this something that I can use? Men, obviously, access from the back passage is fine. You just need to have a few more checks to make sure that your back passage is safe and that it's going to be comfortable for you more than anything. But we know that using these wands can be really, really, really beneficial. So there's oodles of research in men showing the effect of using them in relaxing the tone, but also the pain in the pelvis, but also in women. So the research that we did last year found that if you use a wand alongside normal physio, you get an enhanced response. And if you use it for 6 weeks afterwards on your own, it suggests, the data isn't fully clear because it was only a very small sample, but there is a strong suggestion that people that used a wand did better than people that didn't. Okay, it isn't for everyone. Some people really don't like the idea of using it, and that's fine. If you're comfortable using your fingers, you can use your thumb instead, again at 5 or 7 o'clock, opposite sides with each thumb. Or you can just keep going back to your physio and be taught other ways of releasing it using your breath and other exercises and stretches. Okay, so I hope that was really beneficial. Any comments, any questions, get hold of me at Gilly_Bond or at gillybond.com. Okay, all the best.